Welcome to the Defense and Aerospace Report. I'm Vago Muradian here at the Excel Center in London, where we're covering the DSCI trade show, world's leading air, land, sea, space, cyber, and security trade show. Our coverage here is in partnership with DSCI and Clarion Events, and we have with us Royal Army Medical Corps Lieutenant Colonel Linda Orr, a combat ear, nose, throat surgeon with experience all over the world, particularly in Iraq, where you had some very tough duty. I want to talk to you a little bit about hearing damage, right? I mean, military people, the number of military people I know, especially including, older military people, have sustained some degree of hearing damage over the years, whether it's from jet engine noise, explosions, IEDs, artillery, you name it. Talk to us a little bit about ear health and how seriously the British Army and the British military is taking that.
So it's become really a huge priority for the British military. It always has, but of course it's an enormous topic. It takes a lot of resource to look into it, to prevent, detect and treat this. And so what we've done is we've brought together, through the British Armed Services and the Defence Medical Services here, a collaboration which involves all our NATO allies, our universities, Cambridge, some universities in the States, and also some of the other wider groups such as our Health and Safety Executive. And the aim here really is to make sure that we offer preventative management of hearing loss, that we treat where we can, and there are new exciting ways of treating hearing loss, and that we protect to the maximum amount, both in service and moving forward, that we allow hearing health to be a priority right through to our veterans.
And talk to us about prevention, because the treating of it it's cumulative. So how important is it for you to wear earplugs, hearing protection, how to be aware of sort of noise hygiene? Talk to us about what are some of the things you're doing, because I have kids, they always have headphones in, and I'm always telling them, as somebody who does have hearing damage, you guys got to be very, very careful. This is cumulative, so blasting, and if I can hear it in the front seat of the car, from the back seat of the car, your headset is too loud.
Yes, absolutely. So
and headsets have nothing to do with the kind of noise that folks are subject to in military service.
Yes, but you are absolutely right. We need to start early. So we need to emphasize from the earliest point that your hearing is a sense. To lose it, of course, you don't really see the implications of that when you're 14, 15 or 16 listening to loud music. But I think people are more aware, and of course younger people and younger military personnel spend a lot of their lives on their phones with earbuds in, and for us it's an education that it's not just simply on the ranges or deployed, but it's in daily life. So using noise cancelling headphones when you're in the car or listening to music or in the back or in a noisy environment, and then taking that forward into military service, making sure that you engage with our hearing conservation programs, and that we also make sure that we engage with our personnel in a way that they understand and appreciate. And for us, ultimately, for the fighting war military personnel, what we want is to allow an early assessment, so we understand people in war have to go in noisy environments. To a certain extent we can protect, we can't always, but where we can make differences we want to. So being able to assess people far forward is critical, and we have a great way of doing that, and really close liaison with the American Hearing Centers of Excellence, who have developed a super way of doing a hearing test with just headphones really far forward, and that's being validated. And we now have a way of taking a picture of an eardrum, so we can flash those images, that audiogram back, so a medical officer, someone completely remote from the firefight, can give advice on how to treat that person, whether it's rotating them and resting them, so we intelligently use our personnel and don't put them at risk. Because again, through some work done in the States, we know that a warfighter who can't hear is not going to fight as well. So for commanders, that's an important thing, but we appreciate they need personnel, so we want to do that in an intelligent way. And we also know now there are the early opportunities to treat hearing loss that's acute, and we want the opportunity to be able to do that, and to do that as far forward as we can.
And one of the neat devices, and you checked my ears, so thank you very much. From that standpoint, things looked okay, pretty tidy in there. But that was a very novel device that you put on top of an iPhone, and it has a tiny footprint, and that can generate those images that you're talking about.
It can, absolutely. So a picture or a video, that eye endoscope can be flashed back to anywhere in the world, really. So it allows a very mobile force to still have an assessment, because ultimately the treatments for these, as they develop and mature and become validated, can be done as far forward as the military commanders need or want.
Now, you also told me that there is hope for some people who've lost hearing damage. At least it's, you're testing it on mice. Tell us a little bit about some of the breakthroughs that are coming down the road. I mean, we have no idea whether it's 1 year or 5 years or 10 years or 100 years from now. But tell us some of the, at least, hopeful things. This should not be a substitute for people being loose with their hearing health. But tell us a little bit about hope for some folks, that some kids who could experience blast damage or what have you, but that, in a few years' time might be able to have a treatment.
Absolutely. So the sort of science behind hearing loss has undergone a little bit of a sea change. We know that pure tones, the tones you hear in an audio booth, is one way of hearing, but that has to be integrated in a complex way so you hear it as speech. And so that noise when you can't hear at home with a family, or you're in a restaurant and you just can't hear speech and noise, that's a slightly different type of hearing that's tested for in a different way. And we understand now that the support structures involved in the nerves that do that may be damaged by noise. That's called cochlear synaptopathy. And there is early evidence that place in that pathway of hearing we may be able to regenerate, and that's been shown to be possible in mice. Not our work, and it's early days, but it does give some hope for the future. But I think you're absolutely right. We want to prevent this, not treat it, and so the strands of our work are both in prevention, detection and treatment, and it's a multi-organisation, multi-world collaborative with work going on in many centres, and that particular was not ours, but we are looking forward greatly to hearing the developments from it.
And I want to also ask you, you've been a combat surgeon, and you said how rewarding it is, but it can also be very, very difficult. Talk to us about what the rewards are about being a British Army doctor, the challenges of it that differentiate you from a civilian doctor, but also the rewards.
Well, the rewards are enormous. So we, in the British military, we're a pretty small bunch in comparison to the US, but it means you get to know your teams very well. It's an absolute pleasure and a privilege to work with soldiers in peacetime and in war. I mean, I've worked in many combat zones, and as an ear, nose and throat surgeon one might say, well, is that a priority? But for us, actually, we're generally surgical trained, as I was, and we all work together, and so that emphasis on the team has been great. The privilege of working with soldiers from many nationalities, well, I learnt something every day, and I still do. My clinics, they still teach me, and that for me has been the reward. I mean, there are individuals one helps individually, as my other colleagues have done, actually probably much more so than I ever have, and that certainly is a reward. But actually meeting people and listening to them and understanding some of the things we ask them to do, and occasionally being able to help, has been certainly the highlight of my professional career.
Colonel Orr, thank you so much for joining us. We appreciate it, and very best of luck. And hopefully we stay in touch with you over the coming years and talk to you about ear health and anything else.
Your hearing centres of excellence have doing a sterling job, and they are an enormous help. So I really hope we do stay in contact.
Thanks very much, Colonel.
My pleasure. Nice to meet you.
Sure.